So good afternoon, everyone. I'm Dr. Joss Reimer, the medical lead for the Vaccine Implementation Task Force. This week we learned that Pfizer has officially requested Health Canada approval for the vaccine for children aged 5 to 11. Manitoba's Vaccine Implementation Task Force has been preparing for this latest step in the process for quite some time. And our teams are actively planning for approval to be granted soon so that the rollout can begin in Manitoba. Health Canada will only authorize the use of this vaccine, which is marketed under the brand name Comirnaty, for this age group if their independent and thorough scientific review of all data that was included in the submission shows that the vaccine is both safe and effective in this age group. So this is a really important development for Manitobans because achieving high vaccination rates in both adults and children is key to controlling the spread of the virus, ending the crisis phase of the pandemic in Manitoba, and protecting the mental health of children by keeping schools open and ensuring that kids can participate in all of their normal activities. So although children and youth are less likely than adults to get critically ill from COVID-19, we have still seen, even in Manitoba, children getting critically ill. And we know that even if not critically ill, that children can get sick from COVID-19. They can also spread the virus to others. They can be infected and not have any symptoms. And they can experience the longer term effects that's known as long COVID if they do get infected. The good news is that the vaccine works incredibly well even in young people. This week, there was a new study out of the US that reinforced the importance of vaccinating youth aged 12 to 18 as soon as possible to prevent serious illness from COVID-19. So the study looked at the vaccine effectiveness of 2 doses of Pfizer against COVID-19 hospitalization, looking at June to September of 2021. And they found that 2 doses of the vaccine provided 93% protection against hospitalization from COVID in this age category. And so that's incredibly reassuring that even in young people where they may be at lower risk, that the vaccine is still effective at preventing severe outcomes. When we look at the total number of young people who were hospitalized in that study, 97% of them who were hospitalized were unvaccinated. So only 3% of those hospitalized in that study due to COVID were vaccinated. So this really underscores and affirms what we have already been saying, that it is very important to keep kids out of the hospital by getting them vaccinated as soon as possible. So today I would also like to highlight a success story in our campaign, as the mobile vaccine clinics in Winnipeg are expected to wrap up their efforts by the end of this month. The mobile clinics, which are vans that have been specifically designed to be a fully functional primary care clinic, have operated in a number of regions to reach communities that may face barriers to accessing immunization through other channels. The mobile clinics have been such an important part of the campaign because they have enabled our teams to reach many Manitobans who face a variety of structural and physical barriers to accessing the healthcare system. Our teams met people where they were at, provided valuable health information, and helped overcome hesitancy to receiving the vaccine. From June to October, the mobile clinics have vaccinated over 4,000 people throughout the province. Some of the locations include Winnipeg, Woodbridge, Dominion City, Powerview, Prada, Arborg, Ashern, Beausejour, Brandon, Sandy Lake, Roblin, Moose Lake, The Pas, and Thompson. So I really today want to send a huge thank you to all of the staff, the volunteers, and the community partners that have been part of the mobile clinic teams. We also today wanted to give a brief update on the in-school COVID vaccine clinics. Manitoba schools will be hosting COVID-19 vaccine clinics next week to help ensure that more eligible young people have an opportunity to get immunized. So far, more than 170 clinics have been held in schools, and as of October 15th, more than 1,300 doses had been administered. Of those, about 60% have been first doses. Individuals can also receive their school-based immunizations from an urban Indigenous clinic, and appointments can be made by calling those sites directly or through the provincial call center or online booking system. The in-school COVID immunization program is wrapping up by the end of the month, so we're encouraging parents to sign consents for their children to be vaccinated with first or second COVID vaccine doses so we can help protect more children as we go through the schools. The immunization teams have been attending all schools, and students who were born on or before December 31st, 2009 can continue to receive first and second doses. And then just to wrap up today, I wanted to talk a little bit about what's going to happen next in schools. So as the COVID-19 in-school vaccination program wraps up at the end of this month, we will move to launch the catch-up school vaccination program for youth who may not have received their routine vaccines due to interruptions caused by COVID. The routine school immunization program will vaccinate students against HPV, hepatitis B, meningitis, tetanus, diphtheria, pertussis, which is whooping cough, and polio. Households of youth who are missing one or more of these vaccines have received a mailed copy of their immunization record, which shows which vaccines they are due or overdue for, as recommended by Manitoba's routine immunization schedule. Parents can also expect to get a package from the school with consent forms in advance of the vaccine clinics. And with that, we can go to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Canadian Press, Steve.
Oh, hi there, Dr. Reimer. Given that, assuming that the federal approval does come, what will rollout look like? Because this will be the first big rollout where supply is more than plentiful.
Yeah, that's a great question. We are planning to use a large variety of different options for young people in Manitoba to get the vaccine. So anywhere that's currently offering the vaccine, we want to leverage so that children face as few barriers as possible to getting the vaccine. Likewise, we are looking at a school-based rollout, and because we don't yet know, we don't know for sure that it'll be approved, and we certainly don't know when, we haven't been able to finalize any plans for a school-based program. But our intent would be to offer the vaccine through physician clinics, through pharmacies, through our public health clinics, and then also at some point a school-based program.
And given that, you know, there's every sign indicating that we may be requiring the general population to get booster shots, are you going to keep super center hours open as they exist now? Or the current infrastructure for distribution, is that going to stay as is?
So our teams are always evaluating the demand and making sure that the super sites and all of our clinics can meet that demand, but also trying to be as efficient as possible with the resources and not have sites open where uptake at certain hours or on certain days is not high. And we will continue to be flexible to make sure that we can expand or reduce hours in clinics as per what the demand is. We're looking at potential third dose recommendations for other groups, but don't have anything yet to recommend for Manitobans today.
From CTV Winnipeg, Josh.
Good afternoon, Dr. Reimer. Just wondering if you have any idea of how many children between 5 and 12 would be eligible then to receive that vaccine should that approval come?
Yeah, I don't have the population numbers in front of me, but we certainly can get that through census data and provide that to you.
And a question for Dr. Roussin, if I can. There were some photos posted to social media showing you standing with an attendee at last week's disaster management conference in similar fashion to the 3 cabinet ministers who apologized for doing so, appearing without a mask with an attendee. I'm just wondering if you can elaborate at all on your mask use at the disaster conference.
Well, Yeah, thanks. So, yeah, so we gave a keynote talk at that conference, and so certainly the orders require indoor masking rules. Within there, you can remove your mask to receive a service. And we've always, in public health events that we've approved, we've always said you can remove your mask and photograph. They're going to be able to take their mask off quickly to take a pic with Santa, and we've done the same thing for any kind of event we've approved. So certainly masks need to be worn for the most part, other than those exemptions. And from what I saw when I was there, that was taking place.
From CHVN, Taylor.
Hi, good afternoon. Dr. Reimer, do you have a rough idea of when these younger age groups could be getting this vaccine?
Yeah, I mean, we have estimates. The submission has happened, and so we can anticipate that it would be at least 2 weeks, but probably longer than that for Health Canada to review all of the data to make sure that this is a safe and effective option for younger Canadians. So we're planning for being ready by the end of November. But again, that's a bit of an estimate. There's no way for us to know how long Health Canada will take to complete their approval.
Thanks. And Dr. Roussin, do you know how many COVID cases we've had in children aged 5 to 11 since September?
Yeah, I don't have the exact figure on in front of me. We can follow up with that. Certainly, there's a.
Your audio is breaking up a bit.
Significant proportion.
Your audio is breaking up, Doctor.
Cases.
Try again.
Maybe I'll try, since we are having trouble hearing Brent. We don't have the exact numbers in front of us, but children are making up a large proportion of the number of cases, and increasingly larger proportion in this wave compared to previous waves, which likely simply represents that they're not vaccinated, and many people over the age of 12 are. So we're certainly optimistic that as we can open up eligibility to this group, that will have a major impact on the number of cases in Manitobans going forward.
Thanks.
From the Winnipeg Free Press, Danielle.
Hey, my first question is for Dr. Reimer. I was hoping we could speak a little bit more about the supply for the vaccine for children aged 5 to 11. So are you anticipating that the doses will be readily available? Because as I understand it, we can't use the supply that we currently have in the province. So when do you expect those shipments to arrive? Do you know how large the shipment will be? And can you comment at all about the distribution?
So we have spoken with Pfizer, as recently as yesterday. We had a meeting with them. They haven't provided us with any numbers, but are signaling generally that we can expect a large supply to be available fairly quickly after approval occurs. So that's why we're planning to be ready for a large-scale rollout by the end of November. But again, we don't know exactly if or when Health Canada will approve this vaccine. And we also don't know exactly how long it will take to get doses from Pfizer, nor exactly how many we're going to get. We only know that they've been quite optimistic that it'll be a large number.
Okay, thank you. And is public health planning any additional outreach or information sessions for families when they're considering vaccination for children 5 to 11?
Yeah, so we are having lots of discussions when we're talking about our school-based programs for the 5 to 11-year-olds, because we know many parents will want to be there along with their kids. So having more flexible options, even in the school-based program, is going to be important. We're also looking at doing some additional town halls, either the government or in partnership with Doctors Manitoba, to reach out to parents and try to answer some of their questions ahead of time. We have a pediatric advisory committee that was put together to give us guidance on how and when to do the rollout. And that group has also been very engaged in wanting to reach out to parents and families to get them the information that they need to make this decision.
From Global News, Brittany.
Hi, good afternoon. I'm hoping that we'll have better luck with Dr. Roussin's microphone here. Once there is approval for children 5 to 11, right now we've got public health orders in place of where people can attend who have the ability to be vaccinated. What's going to go into effect, or will children 5 to 11 be brought into these public health orders, of which now they're exempt?
Yeah, thanks. So hopefully my mic's working a bit better. I just left my camera off there. So at this point, we are not planning on removing that exemption from those kids under 12. So we want to encourage vaccination, that uptake as soon as possible in that age cohort. But at this point, we don't have any plans of extending the vaccine requirements.
Perfect, thank you. And this might be for Dr. Reimer, I believe, but Dr. Roussin might also be able to weigh in. Do we have any data right now, or what can we provide to people on the waning immunity many months now after that second shot, and where we're at with, you know, how much that immunity has fallen off?
Yeah, so we have some studies from Israel, the UK, and the US. And overall, what we're seeing is that for people who have, you know, significant health issues, those who are extremely elderly, those who receive their 2 doses close together, that there does appear to be some waning of protection against severe outcomes by about the 5 to 6 month time period. So that's why we recommended 3rd doses for personal care home residents, because they really meet all of those issues in that they have their doses close together. They're generally elderly and generally have more health conditions. But in addition, we are looking at other groups as well to get a better understanding of how other groups may also have signs of waning immunity. The good news is that in the UK and the US, the studies show quite consistently that for people who are young and healthy, that their protection against severe outcomes was not waning. It remained very high. There is some decrease in protection against mild infection, which for the general population is likely not a huge problem, but we do know that for healthcare workers, even mild illness can cause a lot of problems in our ability to staff acute care, and can be a risk for the patients that they're taking care of. So even in that case, despite the fact that young and healthy people are not experiencing waning immunity against the severe outcomes, Shared Health felt it was very important to offer 3rd doses to help bolster our health human resources and protect those healthcare workers with every tool that we have in the toolbox.
From the Brandon Sun, Kyle.
Good afternoon. Now that vaccines for children aged 5 to 11 is on the horizon, what kind of pushback are you guys at the province expecting from people who are, you know, hesitant to get vaccines for themselves, being full adults in the first place? Like, what kind of are you guys planning to spearhead a new campaign to fight more misinformation once these become available to the public?
Yeah, we've certainly seen that a small proportion of Manitobans continue to have concerns about the vaccine, and we do expect that when it comes to younger children, that we'll have more hesitancy than we do for youth, older youth, and adults. For a lot of reasons, that's because of our messaging about the higher risk that older Manitobans experience related to COVID, and there's been a lot of messaging about how kids experience lower risk of severe outcomes. But what our message is that we want to prevent a lot of different things for kids. We want to prevent them from ending up in the hospital, and because we've definitely seen that that is the case for some children. But we also want to protect their participation in schools. We want to protect their participation in after-school activities, sports and dance and art. We want to protect their mental health by having them go back to a more normal way of interacting with their peers. And we want to prevent long COVID for children. So we will do continued messaging in a large variety of mechanisms and in partnership with the physicians and pharmacists that are providing the vaccine to increase the comfort and confidence that families have in providing this vaccine to help prevent all of those negative outcomes for their children.
All right, thank you. And my second question is more of a procedure inquiry. I'm still trying to get data about the amount of employees at the Brandon School Division who have undergone rapid testing. And I just wanted to clarify, who am I supposed to inquire about that? Because I got a response from somebody from the province the other day who says that I should go to the school division, but the school division isn't being forthright with their numbers, or they said they refused to provide me with numbers. So I'm just trying to clarify that point.
Yeah, I think we can try. Yeah.
Yeah, we can take that forward, but I don't think that Dr. Roussin or myself have the answer to that question.
From CJOB, Rosanna.
Hi there. A new study is suggesting children can carry high viral loads regardless of the severity or symptoms of their COVID case, meaning potentially that kids are spreaders of the virus. So could that change any of the protocols we have in place right now, especially in schools?
You know, right now we look at a lot of evidence as it emerges. We've seen evidence in the past that you know, children are certainly less likely to have severe outcomes. We've seen some studies in the past that they're less likely to transmit, and of course things emerge over time when you learn more, and we have a Delta variant now. So we look at all this information and you know, review our processes. But right now we do have a lot of processes in place in schools to make them safe, and we see overall that there is not a lot of transmission that takes place within schools. So a lot of the cases are acquiring this outside of school. So we'll continue to follow it, but we still feel all the process that we have in place are making schools relatively safe at this point.
Thank you. And Dr. Roussin, I understand that you met with Chief Larson Anderson after the last press conference on Monday. Do you have an update for us on how the province is supporting Norway House Cree Nation beyond the 2 public health nurses?
You know, so we're always, you know, available to and leadership in those communities. Certainly, we work with them through the rapid response team and you know, colleagues such as Dr. Marcia Anderson. So I haven't had that specific meeting as of yet, but certainly, you know, open to providing any advice or assistance that's requested.
From the Winnipeg Sun, Josh.
Good afternoon. Just looking at the vaccination demographics, the 12 to 19 age group, or 10 to 19 age group, is at 63.5%. I know there's a section that's not eligible for vaccines yet. Are you surprised that number is that much lower than every other age demographic in the province? And are you getting a sense as to why it is that much lower, especially going through the schools with the recent campaign, or going through schools with the vaccination program?
Yeah, so the number that you're quoting with it being 10 to 19 does include a large number of children who are not eligible for the vaccine at this point. When we look at just the 12 to 17-year-olds, the uptake, the fully vaccinated number is closer to 74%. So really, we're seeing, you know, that the rate in youth is as high or higher than those in their 20s and 30s. And really, it's everybody, from 12 to 39 that we want to see higher rates in. And so we'll continue to communicate with all of those different age groups about the importance of the vaccine for their well-being, for the community's well-being, for their families as well.
All right. And I know the Pfizer vaccine has just gone to Health Canada to be reviewed, but what are you getting in terms of a sense of its efficacy and its safety for those who are between 5 and 11? Are you seeing anything that parents should be concerned about, side effects that have been prevalent in those age groups, like with the myocarditis for the younger males that we've seen? Are we getting any sense of those types of potential side effects for that 5 to 11 age group?
So we have not been able to see the data from Pfizer at this point. So what they've told us is that there weren't any unexpected safety signals that came out of their study. And they also told us that the immune response for children was very strong. At least as good as other groups. And they were very reassured that the vaccine would be effective for this age group. But I would anticipate that there will be an increased risk of myocarditis for these younger children, just as we're seeing it in older children. And we take that very seriously, which is why we're cautious about what we recommend. But we have also been reassured when we look at what happens with the cases of myocarditis, and not just in Manitoba, but really everywhere that's been monitoring this has been seeing that the myocarditis cases are very mild. So normally myocarditis can be a really risky thing, but when it comes to the reaction related to these vaccines, we see almost everyone having their symptoms resolve completely. They end up going home with just some anti-inflammatory medications. And so even while it sounds really scary to hear about something like swelling of a heart muscle, almost everybody has completely resolved their symptoms and been able to return to usual life. And so while we take it very seriously, we are also reassured that this is not causing severe long-term impacts for young people.
From CBC Radio Canada, Emile.
Yes, my question is for Dr. Roussin. The Canadian Union of Public Employees in Manitoba stated that the setup of on-site COVID-19 testing for unvaccinated employees has the potential to transgress the province's Personal Health Information Act. They stated that the testing protocols are too visible. What do you think of these statements?
So what I would say is that during this pandemic, we know that our healthcare system has been under stress. We've seen outbreaks within the healthcare system, so we need to do whatever we can to protect the vulnerable clients that we're caring for. The best way to do that is through vaccine, and if that doesn't take place, then next is regular testing. So it's a very important process in order to help protect the healthcare system as well as the people that they care for. Any specifics around the protocols as such, I would direct those questions to Shared Health.
All right, thank you. But still, are you considering some options like self-applied tests at home, maybe?
So again, the actual protocol of how this is implemented, it isn't addressed in the public health order. So the various employers are looking on what's the best way to implement this, and certainly it will be context specific. So any specifics on the implementation in a certain area should be addressed to that area.
All right, thank you.
From CBC Manitoba, Ian.
Good afternoon, Dr. Reimer. We on Monday we had an increase made to the people eligible for the booster shots, First Nations people on reserves. I know you say there's attempts to do more on that front, but what sort of demographics, what groups could be included next? Where's our priority?
Yeah, so like I said, we're looking at data right now. We've certainly seen from the UK and the US that elderly individuals seem to experience more waning than younger populations. And we know that NACI has provided some guidance on elderly persons in congregate living. And then we've also seen in the UK data what they described as people who are clinically extremely vulnerable, so having many different health conditions. So these are the types of things that we're looking at in Manitoba, and I do expect that at some point we will be recommending third doses for other groups as well, but just haven't had a chance to see data today that we're ready for that recommendation.
Thank you. ICU numbers, or I guess the number of occupied patients in ICU beds is up over 90 again. We've gone down to the 80s in sort of recent days and weeks. Is this a trend line that we're seeing that, and should we expect more?
So related to COVID, we've seen in the last week or so fairly stable numbers. We're concerned that we can still see increasing case counts, and with that would come increasing ICU numbers with it. And you can see that, as of right now, COVID cases are making up not a large proportion of those ICU cases, but again, any details regarding the ICU capacity and such should also be directed to Shared Health.
Thank you, doctors. We have time for just a couple more questions. Please proceed.
Dr. Roussin, it's Brittany from Global. We've had a lot of questions from people, again, regarding that indoor mask mandate when it comes to when you have to be wearing it, say if you are speaking at an event, and what constitutes an indoor public place. If it's a place that is normally open to the public but closed because it's a ticketed event, say like at the art gallery or a conference or something else, do speakers have to be wearing their mask when they're up there? And how does that also apply then to a church pastor?
Yeah, and so typically if it's an indoor event that includes the public, these rules are going to apply. Again, for any specifics as they relate to a certain event, we can certainly address through our through government to provide specific advice on it. We have performers are allowed to remove their masks. People speaking at these events are allowed to remove their masks. Certainly allowed to remove your mask for a brief period of time to receive a service, such as taking a picture. We know you can, remove your mask if you're going to be consuming a beverage or a meal. So for the most part, that mask should be on. There are brief periods where it's reasonable for it to come off, but should be replaced as soon as possible.
Dr. Reimer, do you have an estimate in terms of what you're expecting in terms of vaccine uptake in that 5 to 11 age group? You do expect it to be lower than other age groups. What's that number?
So we don't have any data from Manitoba specifically, and overall Manitoba has often seen higher uptake than some other jurisdictions. I know there was a national level poll that found that just over half of parents intend to have their kids immunized as soon as possible, and that another quarter might wait a little bit, but do also intend to have their children immunized. So we don't know specifically in Manitoba what numbers to expect, but we will plan to see to be ready for the same uptake that we saw in youth and young adults, because we want to make sure that there's no barriers for anybody who wants to have their child immunized.
Dr. Reimer, Justin Aldridge with Winnipeg Sun. With the school program, do you have numbers regionally? Were you seeing many students in, say, the South where there's such low uptake getting the shot through school? Or getting the vaccine through school? Do you have that kind of a regional breakdown on the success of the school program?
Yeah, I haven't actually seen a breakdown by region. I'm not sure if that's something that's been put together or not, but we can ask our epidemiology team if that's something that they might be able to provide. But to date, don't have it broken down in that way.
Hi, Dr. Roussin. Can you give, I guess, an update on Halloween and whether that will be, if trick-or-treating is safe to do this year, and what kind of advice you have for get-togethers, especially with unvaccinated children?
Yeah, so we do have advice posted online in this regard for the most part still the fundamentals and following the public health orders that are in place. So so indoor gatherings in private residences when anyone eligible there is not vaccinated is limited to 5 people, and outside is safer. So online we have some thorough advice on how to safely participate in Halloween.
Time for one more.
Josh Crabb here from CTV. I just wanted to follow up as we lost a bit of your first answer on the disaster conference. And I know you just answered the question that it's okay to remove your mask briefly for a photo. It doesn't say that in the orders. So I'm just wondering if, the 3 cabinet ministers who apologized for removing their masks at the art gallery, do you feel it was necessary for them to do that?
If it was, I don't have details on that other event. If it was simply to remove a mask for the purposes of getting a photograph and then you place it back on, then that's very consistent with our approvals of many events that we've already approved and those going forward. So for that, in that regard, that's in keeping with advice we provided.
Thanks, everyone. This concludes our go-to session.